So when we're talking about stakeholder engagement in the MAPP process, there's really two groups we can think of. We have both sponsors as well as stakeholders. Now, sponsors are really these key organizations and individuals who are in the community who really offer the initial support for the MAPP process. And they tend to have a management or leadership kind of role in the planning and implementation process. So that they're kind of looked as the advisors for the community improvement effort. They're able to really leverage their high up abilities to gather more partners who might not necessarily join a community health improvement process at the beginning. So stakeholders are really people and agencies and organizations that have an investment in the health of the community and the local public health system. So this is a variety of people that both benefit from as well as kind of deliver these services that really improve the health and well-being of the community. And so we really want to look at, again, the traditional and non-traditional public health partners, making sure that they're both represented at the table. So having local health departments in the hospital systems, academic institutions, as well as things like the local housing authority and regional office of education, looking at parks and recreation and the forest preserves, looking at the community in a holistic sense, knowing that there are people and organizations and sectors that both directly and indirectly affect people's health. I'm going to give a couple examples about really local stakeholder engagement in the MAPP process. So they're both in the community themes and strength assessment. So first of all, we did a community themes and strength survey where we really, again, looked at the ideas of how people perceive their health and well-being in their communities and what are strengths and opportunities and what are community identified health issues. So to make this survey as community-based as possible, we really included a mixed group of people in the planning process to ensure that the wording was very accessible to a variety of groups, as well as making sure that it was able to be translated into Spanish, and just making sure that it wasn't just one group creating a survey and then sending it out. We had buy-in from various stakeholders to make sure that this was a culturally sensitive survey and to make sure that it was like linguistically appropriate and people would understand it in the community. We were able to partner with key organizations in the community to help distribute this survey. So both the steering committee as well as the steering committee of recruiting organizations to help it, we were able to have this survey sent out online through emails and web blasts, and it was posted on people's websites and organizations' blogs. So it was really using all the connections in the community to get this survey out, to get as many people in the community to take it as possible. And then another example, after we did the community strength survey, was we really wanted more community input. So surveys can only really sometimes provide the what. So we had strategic focus groups with populations across the county to really learn about their stories and get more of the whys and hows. So we had focus groups with a community in Waukegan with African American residents. We worked with an organization in Mundelein to recruit Korean American residents. We worked with an organization to talk with people with physical disabilities or visual impairments, and then we also had a focus group conducted in Spanish with Spanish-speaking residents. So this is the point. We were talking to the community members. There was no more barriers between the assessment process. We were actually talking to the people who are living day to day, and community health is a big issue and affecting them. And so we really wanted to understand from their perspectives what were their strengths and identified opportunities. The first thing with stakeholder engagement and collaboration in the community is it's really important to get the right people at the table. You want to get people who are really passionate about the issues, but like can actually do something about it as well. You don't want just meetings where you're just talking. We always want to do data and program planning to action. It's really important to make sure that these stakeholders are given meaningful, engaging, and defined roles in the process of improving community health. We're not just using them for their organization's name or their face. So we need to be able to give these stakeholders valuable information for the sake of participating in. We need to make sure that they're getting something out of it that they can bring to their organization, so that it's not just how can you help us, it's how we can all support each other to improve the health of the community. It's really important to have individual conversations with the people on your committees or planning teams or action teams. They need to be looked at as more of an amalgamation of their organization. They really are on the committee for a purpose. So you really want to learn about their individual stories, because that will not only create a better rapport with you and the people on the committee, but like it really makes it more meaningful for everyone, which ultimately will lead to better work done. You really want to be able to have these conversations with them so that you can understand what their strengths are. What is their wheelhouse? Are they better at planning? Are they better at, working in the world of policy? You really want to have these conversations because you want to make sure that their time is being used as effectively as possible. There can be a lot of issues with community engagement and project sustainability. So you can get all the right people at the table, but life happens and projects will fizzle out and funding streams come in and come out, and so not everything is going to be necessarily continued. There's a lot of external forces that can affect the sustainability of a project. A couple different things that can be done to help ensure project sustainability through community engagement. It's really important to have the members on the team really know the long-range goals of the project, because you want to know that they're working towards something. They want to know that what they're doing is going to make an impact, and they want to know the steps along the way. It's very, very, very important to use data-driven decision-making. When we, throughout the entire MAPP process and in the prioritization process, we continually come back to using data to make decision making. So that's why we use the Hanlon method to have that objective ranking of the health issues. So when you're working in a committee or an action team, you want to be using the best data for the best outcomes. You're always checking back to, are the activities we're doing now connecting to that action team or committee's vision for what the point of their group is. And then finally, it's really important to review accomplishments that the committees have been doing. Sometimes you get caught up in the minutia of projects and, we need to get these resources to get this done and that done. And it's hard to see the bigger picture. So it's really important to take time and recognize the great work that everyone's doing and how it all connects to the bigger picture.